Hello, this is Dr. Irene Hausinger from St. Martin's University, and today I'm going to be talking about the process for becoming a substance use disorder professional in the state of Washington. There are four main steps to the pathway to certification. The first step is to get your coursework, and you'll need 30 semester credits in specific SUD topics, or 45 quarter credits, or 10 semester credits for the advanced practitioner pathway, which I'll be talking about a little bit later. The next step prior to your internship is to get your SUDPT application. As soon as this comes in the mail, then you can legally start to see clients. Your first 50 hours have to be supervised, and all agencies where you'll be doing clinical work with SUD clients are going to want you to have this if you are going to be trying to get the SUDP credential. The next step is to work and get your hours. Supervise clinical experience under an SUDP at an approved work site. And then the fourth step is to submit all of your application materials and to take the examination. Most people take the NADAC test, but there is the ICRC test as well. And then once you successfully complete all of those steps and pass the national examination, then the Department of Health will mail you out your credential, and then you are a full SUDP, substance use disorder professional, formerly called chemical dependency professional. You might hear that sometimes because we've been using that term for a really long time and just recently switched within the last year or so. There are two pathways to becoming an SUDP. The first is the traditional pathway, and these are for students that are at the associate's, bachelor's, and master's level. You need 30 semester credits in the specific topics, which we'll talk about a little bit later on. And depending on your education level, this requires 1,500 to 2,500 clinically supervised work hours under an SUDP and requires the national exam. If you are an advanced practitioner for a working licensed professional in specific areas, as defined by the WAC, which I'll show you in a little bit, in good standing, you can do the advanced practitioner pathway, where you would have 10 semester credits in specific SUD topics, and this requires 1,000 clinically supervised work hours under an SUDP, and it also requires the national exam. Becoming an SUDP professional. This is just a linear view of what we just mentioned. So you become an SUDPT, substance use disorder professional trainee, you take your coursework, you get your clinical hours, you submit your application, you take and pass the examination, and then the credential expires each year on your birthday. So you have to prepay your application, which is $260, and then your initial certification is $295. And so then you're looking at $555 plus the examination fee. And depending on which exam you take, that could be anywhere from about $125 to $150, last time I checked. Okay. Every year on your birthday, it expires, so they're going to mail you out a credential renewal about 90 days before your birthday. Don't let it expire because then they are going to fine you $150. If you're retired and you want to renew it, you can do that. And if you need to have extra copies of your license, you can have that as well. But you can also look up your credential online on the Department of Health website. Okay. So step one for the traditional pathway. So if you are an associate's, bachelor's, or master's level student, then this is what is going to apply for you. Applicants must have an associate degree in human services or a related field, or successful completion of 90 quarter or 60 semester college credits in courses from an approved school. At least 45 quarter or 30 semester credits must be in courses relating to the substance use disorder profession and must include the topics in the WAC. When you apply, you will submit your original transcripts of all of your coursework with your SUDP application, and the state will go over this and make sure that you have all of the required topics covered in your education. Here are the required education topics. You will find a topic matching worksheet in the application for the substance use disorder professional. And one of the things that I do for my students is I will sit down with your transcripts and we will go over all of them, and I will map it out for you and actually fill out the topic matching worksheet for you. If you are a BSW student or a psych student, I have this already done, and then we can just go over your individual classes and plug it in. So here are the required topics: understanding addiction, pharmacological actions of alcohol and other drugs, substance abuse and addiction treatment methods, understanding addiction placement, continuing care, and discharge criteria, including ASAM, cultural diversity, including people with disabilities and its implication for treatment, substance use clinic evaluation, HIV/AIDS brief risk intervention for people with substance use disorder, substance use disorder treatment planning, referral and use of community resources, service coordination, individual counseling, group counseling, substance use disorder counseling for families, couples, and significant others, client and family and community education, developmental psychology, psychopathology/abnormal psych, documentation to include screening, intake, assessment, treatment plan, clinical reports, clinical progress notes, discharge summaries, and other client-related data, substance use disorder confidentiality, professional and ethical responsibilities, relapse prevention, adolescent substance use disorder assessment and treatment, substance use disorder case management, and substance use disorder rules and regulations. It's important to note that you can use the same class for multiple topics. The advanced practitioner pathway is similar. It's just a little abridged. So if you are one of these professionals in good standing, then you could qualify for the advanced practitioner: a psychologist, marriage and family therapists, mental health counselors, advanced social worker or independent clinical social worker, an osteopathic physician, an osteopathic physician assistant, a physician or physician assistant. And it's similar, but just abridged. So you would take 10 semester or 10 or 15 quarter credits in survey of addiction, treatment of addiction, pharmacology, physiology of addiction, ASAM criteria, individual, group, family addiction counseling, and substance use disorder law and ethics. So I'm going to backtrack a little bit. So before you become an SUDP, you must be an SUDPT. This can be done at any time during your coursework, but must be done prior to your internship placement because you cannot accrue your hours legally unless you have this. You have a 5-year clock from the issuance of your credential, the SUDPT, to complete your coursework, clinical hours, and sit for the exam. So you can renew this 4 times, and you have a 5-year window in order to get this done. If you don't fulfill those 4 requirements that I talked about earlier within that 5-year period of time, then you cannot continue the credential. And the reason for this is because previously, up until a few years ago, there was not any time limit on becoming an SUDP. So we had SUDPTs that were trainees for 10 years sometimes. What happens is when you are an SUDPT, your supervisor is legally liable for your treatment decisions. But when you become a full SUDP, then you become liable for your treatment decisions. And if you're an ethical practitioner, then this shouldn't be an issue. And you also get a substantial pay increase. So the Department of Health said we have to do something about this because we are still at a point where we don't have enough fully credentialed people and not enough fully credentialed supervisors because of this unevenness. So it's about half the cost of becoming a fully credentialed SUDP. Your application is $110. You renew it, it's $90. So unlike your full credential that expires on your birthday, if today is March 18th and you do this today, it's going to expire March 18th a year from now. So step 3 in our process, clinical work for traditional and advanced pathways. The number of clinically supervised hours that you have to have is directly related to your education level. So if you have an associate's degree, you have to have 2,500 hours of work experience. If you have a bachelor's degree, 2,000. If you have a master's or doctoral degree, 1,500. And if you are licensed in the alternative track, which we just talked about, then 1,000 hours. All of that experience must be under an approved supervisor as defined by the WAC. The first 50 hours of any face-to-face patient contact must be under direct observation of an approved supervisor or a substance use disorder professional. Accumulation of the hours is not required to be consecutive. Supervised experience is the practice as referred to in the RCW, and it's the experience received under an approved supervisor. A practicum or internship taken while acquiring the degree is applicable. And the department will accept only experience that has been completed within 7 years of the application date. So this is also important to note. This is how this differs from mental health. You must be in a licensed facility for SUD services. And unlike mental health, where you might see clients and then hire an external supervisor and then they go over your work with you, you have to be in a facility with a supervisor that can answer your questions. So for example, college mental health centers, college wellness centers, that does not count. It's going to have to be a treatment center like inpatient, outpatient, or maybe you have a treatment center that contracts out. So sometimes you might be an SUDP or an SUDPT that goes out to the jail and does assessments, or maybe you go out, you work at an agency, but your site might be a satellite site at a school. But you still must be supervised by an SUDP. So there are some sites that if you're in mental health, unless they're duly licensed and you're actually getting that supervision, it's not going to count towards your SUDP at this time. Right. So you need to be able to track all of the competencies as you are working, and I have a spreadsheet to help you with that. And so what I recommend is that you actually track everything that you do daily on this spreadsheet and then add it up every month, and then you and your supervisor discuss it to make sure that you're getting the competencies. And this is right off of the application form for the Department of Health that your supervisor signs. You have to have 100 hours a minimum of face-to-face clinical evaluation. So a lot of that's going to be your ASAM. Other clinical evaluation, that could be transferring peoples to level of care, face-to-face counseling, including individual, group, family, couples, and significant others, and discussions of professional and ethical responsibilities. Now, this is where everything racks up very quickly. Your transdisciplinary foundations. Anytime you go to a training, understanding addiction, treatment knowledge, application to practice, professional readiness, anything like that, staffing with your supervisor, what the topic is, you can count that. And then these are most of your daily tasks: referral, service coordination, client, family, and community education, documentation to include screening, intake assessment, treatment plan, clinical reports, clinical progress notes, discharge summaries, and other client-related data. So this is where you're going to track exactly how much you have here. So everybody has this, and then depending on your education level, you're going to track this. And I recommend doing this, again, daily, because it's going to be a little challenging to remember. Some agencies are really great about this, and they have electronic case management systems where if you have an assessment scheduled and it takes about 3 hours to do an assessment, then it's automatically going to tally up your hours for you. But technology does fail, and it's a good idea to track it yourself, especially since you might switch agencies in the time that you are getting your credential. So it's your responsibility to make sure that you have everything signed off on. All right, your certification examination. Here are your steps. You submit your application to the Department of Health. The DOH credential specialists review. Once approved by the DOH, select an exam, and then they'll send you the information. You take the exam. If you're successful, the DOH will mail your credential directly to you. And you can take the NADAC, the National Association of Alcoholism and Drug Counselors, level 1 or higher. The NADAC is our governing umbrella for addiction professionals. I highly recommend that students get a NADAC student membership. It's $42.52 if you're a resident of Washington. That changes based off of your state, how much you'll pay to the NADAC. But once you pay that, you can take unlimited webinars and get free CEUs, which is fantastic, including your HIV, bloodborne pathogens. You can take hundreds of different webinars, and they have a lot of different topics that you can choose from. So it's a great way to get a lot of training for just a little bit amount of money, especially when you're a student. Please take advantage of that. Okay. So after you complete those 4 steps and you become a full SUDP, we call it dropping the T, then every 2 years you're going to have continuing education. And the purpose is to add to the professional know-how of the substance use disorder professional. A well-rounded continuing competency program focuses on all aspects of professional practice to make sure SUDPs provide safe and quality care to patients. And the purpose of the professional development activities is to broaden the experience that an SUDP may assume to maintain competency. So what does this mean? This means that we are lifelong learners, and in order to be competent, healthy, knowledgeable professionals, learning doesn't stop with college. And so we're going to learn on the job, we're going to go to conferences, we're going to take online classes. There's a lot of different things that you can do. So every 2 years, an SUDP must complete 28 hours of CE, continuing education, and 12 hours of other PDA for a total of 40 hours. Okay? And you must complete an enhancement plan. Every 6 years, and this is new, it's not just delimited to substance use disorder professionals, it's actually all healthcare professionals now in the state of Washington. You must complete at least 3 hours of training in suicide assessment, including screening and referral. So here are the continuing education requirements. And the topic should look a little bit familiar to you now. Understanding addiction, pharmacological actions, substance abuse and addiction treatment methods, ASAM, cultural diversity, chemical dependency, HIV and AIDS, referral and use of community resources, service coordination, implementing treatment plan, consulting, etc., individual counseling and group counseling. And you have to have at least 4 hours in law and ethics, and then the remaining 12 hours can be obtained through peer review. You can serve on a formal peer review panel or committee or individual review of a sole provider. You can take a practicum. You can present. If you do a workshop, this can count. If you write or publish, you can do that. Or other activities as determined by an SUDP supervisor. So for example, teaching a class or a workshop or designing a lecture, something like that would count as well. Okay. So there's some definitions here just to guide you when finding continuing education materials. So continuing education is a program or course including distance learning, seminars or workshops, professional conferences approved by an industry-recognized local, state, NADAC, national, international organization, or institution of higher learning. And we just discussed the PDAs. Here is a list of industry-recognized institutions, and there certainly are more, but we have the NADAC, the NATAP, the ICRC, International Certification and Reciprocity Consortium, Northwest Indian Alcohol Drug Specialist Certification Board, Chemical Dependency Counselor Certification Board, institutions of higher learning, so for example, St. Martin's or college, or DASA. They will accept distance learning and agency-sponsored training, and agencies are required to give you training, in-service training, and continuing a competency enhancement plan. So you should be meeting with your supervisor to discuss your professional development plan. All right. So this is just going a little bit more in depth in terms of how you can get your hours, your peer review, public presentation, writings, CE, and then you must document it. So the dates that you were in this activity, and if you're teaching something, the title, location, and the name of the instructor, and also if you were contributing to that. Okay, so some important resources for you. The Department of Health webpage. This is where you're going to find the applications, any laws that are changing, all of the laws that directly impact our practice. This is the NADAC. Again, I highly recommend that you get a student membership while it's inexpensive for you. NATAP, and then SAMHSA has fantastic material. They have the tip series. They're no longer printing it. You used to be able to get copies of it mailed to you, but now they've gone paperless, which is great. And you can get it in a PDF or HTML, and they have a lot of different treatment topics that you can choose from if you're working with specific populations. So I highly recommend that you go there and just check out their information. My favorite part of the tip series is actually looking at the appendices, because there's really great tools in there, and also the resources and the research that goes into the tips are really, really thorough. Okay. So now I'm going to transition and talk about our grant at St. Martin's University. We received a $1.0 one $5 million grant from the HRSA part of the government, federal part of the government, to give $10,000 stipends to master's level students, so our MAP students, for working in SUD/OUD, so substance use disorders with a focus on opiate use disorder. And so depending on your internship placement, you might qualify for this. So this is our timeline of what we're going to be doing. If you are a first-year student, you can certainly familiarize yourself with the materials. What we are asking, though, is the real work comes at the second year spring semester. You'll contact myself or our faculty field liaison, and we will sit down with you and figure out where your geographic location is. Maybe we can have a placement kind of close there to lessen the burden of driving. And then what your population interest is and well. Do you want to be an inpatient, outpatient, other specific populations that you have a passion for? And then we'll make 2 or 3 placement recommendations. And then we'll give you that contact information for the placement. You'll contact the placement directly and interview. And then if you get an offer, you can accept that, the best one for you. And then our faculty field liaison will be the primary point of contact for you within the first 3 weeks or so of your third year, first semester internship. She will go out and do a field visit. Okay? And then our faculty field liaison is the person that is going to be tracking your hours. So you can earn $5,000 per every 300 hours, up to $10,000. So for the MAC internship, you do 300 hours each semester, and that is paid through financial aid towards the end of the semester. Okay. It does not have to be consecutive. It can be within a 12-month period of time if something were to happen and you weren't able to get all those hours in a row. Okay. And so that's important to know as well. Okay. And some site placements are going to qualify and some are not. And one of the important things to note is with our grant is that you do not have to, if you are in a clinical site with SUDP, like inpatient or outpatient, you're definitely going to have to get the SUDP credential. However, our grant stipulates that it's not delimited to specific clinical practice. However, for MAC, you are in clinical. So the example here is college wellness centers where you might be doing SUD work or an SUD program. It's under mental health and it's under the college, so it's not a state licensed facility. So you can access the grant monies, but your hours working with those clients, even if they have substance use issues, are not going to count towards the SUDP credential. Okay, same thing. If you're at a mental health agency and you're not getting SUDP supervision, you can't just have an SUDP clinical supervisor come and look over your notes, not like you can with mental health. You'd have to be on the SUDP side with your SUDP2 credential under the supervision of an SUDP, getting those hours in those specific competencies. So again, for the grant, you don't have to necessarily get the SUDP credential. You do have to work with an SUDP OUD population, but those hours would not necessarily count towards your SUDP credential if you are not at a licensed agency for SUD. Okay. So this is our timeline, just in a different format. So your first year spring or second year spring in the MAC program, you would be coming and talking to us, and then we would have an advising appointment for you somewhere between January and April. And then our faculty field liaison would be doing site visits once a semester or more if your site requested that. I hope that this has been helpful, and please feel free to watch this as many times as possible, and you can also email me, ihausinger@stmartin.edu. Thank you so much for your time. We look forward to giving you money for the grant.